In 2006, Dr. Spadafora, one of our city oncologists, and Mary Catherine Cameron, an instructor at the nursing program in Sioux College, got together and set up a survey with the help of the nursing students of the breast cancer patients in the city, asking them what they thought was needed to help them get through their breast cancer journey. The overwhelming response was a support group.
I was diagnosed 2 years ago, and one day during an appointment at the cancer clinic at Surrey Hospital, I saw a little white paper on the bulletin board in the examination room, and I tore off a little tag that had a phone number on it for the breast cancer support group. And I followed through with a phone call and got a voicemail, but recognized the family name, and I knew the woman who was a co-facilitator, and eventually caught up to her by coincidence in person and had a wonderful chat one day and had a personal invitation. And so I drove up from Thessalon for the meeting and was really happy I did. It was a wonderful experience, and I've kept on coming and have become a co-facilitator.
I was diagnosed 11 years ago with breast cancer. I went through my treatment. I knew of these meetings, but never came. I thought I was fine and I didn't really need any, but what got me to come was we had a guest speaker who I was very interested in. My attendance at that meeting is what got me involved in the group, and once I did, I realized how much I was learning. Every meeting, somebody comes up with something that you didn't know that can help you with your journey.
I was diagnosed with the breast cancer 4 years ago, and I was very fortunate that prior to my surgery, a friend of mine told me about the support group, and I came to a meeting just before my surgery, and I was able to observe and listen and get a lot of tips from the ladies around the table. And also I was given the very comfortable pillow that we all get that is very, very helpful after the surgery.
We meet every third Wednesday of the month. City Hall is very generous and lets us have a room. 7 o'clock till 9. We meet to provide support, comfort, coping skills to anybody who's had breast cancer. Men can get breast cancer. 1% of breast cancer patients are male. Any man would be welcome if he needed our assistance. We provide tips that only someone who has been there can do. We provide hope. If you're new to this, it's encouraging to know, oh, that lady's been out of treatment for 10 years and she's doing just fine. We provide reading material. We provide encouragement. We provide a forum to vent. Everybody has fears and concerns. We provide practical tips. When you're new to this, you have so many questions. How am I going to get through chemo? Will my hair really fall out? Where can I find a good wig? All those things, you're not going to get answers from anybody except somebody who's been there. All the ladies at our meetings have been there. We have reading material. We have breast forms that people gift to us when they decide to change sizes, a lot of ladies do, or when they unfortunately pass on, their families give us breast forms. We have these lovely comfort pillows that are provided to us by Zonta as an outreach service, which a lot of the ladies really like because after their surgery, they can sleep on that side, their arm can rest gently on that side, comfortably.
A lady in the Sioux, I believe she used to live in Thessalon, Helen Patterson, and a group of friends started making these scarves a few years ago. And they have been in the goodie bags at the Relay for Life. And so this has become a symbol when we have a new member or anybody comes to a meeting, if they don't have a scarf, we're happy to give them one. And it's just kind of a symbol of who we are, the pink and the white, recognizing breast cancer. And sometimes you wear them to our meetings, you'll see them wearing them in public or maybe at a special meeting or one of our other social gatherings. And it's just a little reminder of the support that the group offers.
We also have great variety of books and movies that we can watch. We get guest speakers. We had a nurse and the manager of the radiology, and so they're very beneficial. And you come and take away what you want. If you don't want to come and speak, that's fine. You can just listen. But when you want to talk about something, we are here for you to listen and to support you and to cheer you on.
We have a registry of women who have come to our meetings. It's well over 100 names. We usually get about a dozen at our meetings. Women come and go as their needs call to them. A lot of women don't come ever because they feel like I did at the beginning. I'm fine, I don't need it. No, you don't come because you need it. Come for the friendship, the fellowship. You're going to learn things. You'll always learn things. You'll meet new people. You really don't, this is a massive thing to go through, and every woman goes through it in her own way. And for a lot of people, they really don't need anybody. They just want to get it done, close the door and put it behind them, and that's understandable. But for somebody who has any questions, or even if you don't, you'd be surprised what you would learn from coming to meet with us.
We have been very fortunate. We have no real expenses, and we have a wonderful group of young ladies in the Sioux from Notre Dame to Grand Lac. The two volleyball teams have they have gate receipts from their local games. They just charge a small fee for people coming to their games, and with that collection, they have donated their funds to the Algoma Breast Cancer Support Group. And we have used that money. A few years ago, those funds were donated to Sioux College, to the hairdressing program, where they restyle wigs that are used for any cancer care, women going through treatments and chemo and have lost their hair. So that has been a valuable resource for us. And the last couple of years, we've treated ourselves to lunch. We've gone out as a group. Last fall, we went to the old stone house and were treated royally, and had a lovely lunch, had a wonderful social gathering where we could let our hair down and just laugh, just enjoy. And some of us dressed up in pink, some of us dressed up in fancy hats, and we had some fun. And everybody needs to do that. That's good therapy.
For myself, they were very beneficial, especially for someone who doesn't have a lot of family in the city. You know, the kids have moved away, and so it's very important to have someone to tell your story to, and get support, and just to know what to expect. You can read all kinds of materials and books and things that you get at the cancer clinic, but it's different when you actually go through treatments and you come across some side effects that were not mentioned in the book. So all of a sudden there's someone in this room that can tell you about this. Oh, I've experienced that, and this is what I did. That's what worked for me. They're not giving us any medical advice, but it's good to know that you're not the only one. You get support, and you can tell everything. Everything stays confidential, and it's just a great group of women. We laugh and we cry and we support each other, and we know that when I say something here, it won't go past this door. And it's very important because some people don't want to go and tell everyone about their cancer treatment.
I find it very relaxed. It's a casual, informal atmosphere, a lovely, bright room, wonderful group of women, and in a non-clinical setting. You can vent, you can share, we can laugh, we can cry. There are no limits. We're all respectful of each other, and we all take time to listen and to share and to care.
I would say don't be afraid, you're not alone. It's unfortunately it's a very bad disease, but Together we can help each other to get through this journey.